All right. Hello, everybody. This is Jennifer Cuartas doing a really quick video tutorial to help you um, to navigate verifying the insurance for Medicare and also cover the frequently asked questions that people are asking regarding supplements versus Medicare Advantage plans. Now, Medicare insurance, as you very well are aware, if you're on our teams, it's designed for individuals 65 and older or for those who are disabled. Medicare has a couple of parts to it. What we are looking at normally is National Medicare, Medicare Original, also it is called. This is your red, white, and blue cards that you see presented by our senior citizens. This is parts A and B. That's your hospital and medical coverages. Part B is the one that we are usually looking for because some cards presented may be missing an A, but they'll have a B. Or vice versa, but we are looking for Part B because that's what covers preventative services, lab tests. That's what we're doing, right? Now, sometimes you'll hear somebody say, I have a supplement. Sometimes they have a replacement of their Medicare coverages. So let me explain the difference between the two. Regardless if the person uses the word supplement or advantage, know and understand a lot of times they interchange those and don't really understand what they mean. So when somebody presents you a red, white, and blue card or another card that says like Humana and then underneath that says Medicare product, or says the letters CMS on it anywhere, little red flags should go off, little buzzies should be going off in your head to immediately shift to research mode. So let me explain to you the differences real quick, and then I'm going to show you the card and how you verify what your patient actually has, because 95% of the time they don't really know. Now, a supplement plan is in addition to what their Medicare Original red, white, and blue card, parts A and B, it's in addition to or fills in the gaps of the deductibles and co-insurance that they become responsible for financially when they have some type of procedure or test or hospitalization that parts A and B don't cover, okay? It makes it a little bit easier for them to live on a fixed income and still get the medical services that they need. But some people opt to get a private policy that replaces their Part A and B coverage. That's called an Advantage plan, okay? Sometimes you'll hear it referred to as Part C as well, but what it does is they pay a premium every month, and then it lowers their out-of-pocket expenses and usually covers more services that A and B don't cover. So it becomes better on their budget for people who are more sickly or have chronic illnesses. So you want to know the differences between these two. If somebody has a supplement, they will give you their driver's license, their red, white, and blue card, and that additional card. If they have an Advantage plan, they may only give you their, in addition to their driver's license, their Advantage plan. They may not present a red, white, and blue card, and that is okay. Now, what I want you to notice and take note of here is that there's a couple of different types of cards out there circling. This is always going to be inclusive of the same information, though, so you'll know no matter what aesthetics are different on the card. If it's red, white, and blue, says Medicare Health Insurance, has their name, their Medicare ID number, maybe called a claim number, but it has Part A, Part B, that's your hospital medical coverage with an effective date. You want to immediately ask them, do you present another card with this when you go to the doctor? Now, sometimes they'll tell you no, even when they should be presenting another card because maybe they're new to that plan. So again, you want to be a little bit of an investigator, and now you want to go ahead and head over to protect yourself, to look more efficient and proficient and professional. You want to head over to the Medicare site to verify before you put anything into our portal whether or not they do have Medicare A and B only, or do they have an Advantage plan that's replacing this? Because again, if it's a PPO or an HMO, that plays a factor in whether or not they actually qualify. And our job is to be really good at intake of information and pre-qualifying our patients. So I'm going to go ahead and head right over to the Medicare.gov site for you to check it out. All right, so here we are at Medicare.gov. Now, I want to show you something. The reason I'm taking you here to this site is because when we talk about going to the Medicare.gov site to double check and verify what kind of insurance somebody has, instincts tell us go to Medicare.gov and click enter, right? But if you're out with a patient and you start going, what do I click on? Which one of these is what I'm looking for? You start looking kind of unprofessional. Now they start questioning, they don't know where to go. They're looking at all these different links. So I want to give you the actual direct site that'll take you behind the scenes of Medicare.gov, that'll take you right to the form you need to fill out, okay? But I wanted to show you this first because it's not very user-friendly, okay? So play with it a little bit before you go out there with your first patient. But to make it simple, I went ahead and I already entered in the direct link. Now notice it goes right to what we need to input to find out whether or not somebody has a plan we take. But I want you to notice something else. Take a look. It says www.medicare.gov/find-a-plan/questions/home. Will you ever remember any of that? Probably not. So there's two things that are going to make your life a whole lot easier and make you look super professional. First thing is, you can always click to bookmark this page, or I did put a tool together to make it a little bit more simple for you. And you can go to bit.ly/AHS.Medicare. And if you're not familiar with how to write that out, it's bit.ly/AHS, which stands for Advanced Healthcare Solution Medicare. All right. When you go to that, it's just a shortened version of that initial site. And you see it takes you right to the enrollment page where you can check your client's information. Now, I'm going to go ahead and just enter in the information of a client that we had earlier this week. And I want you to note in the portal, we have you enter in all of the dashes, but on the Medicare site, you do not do that. You just enter in the number. It's a combination of letters and numbers. It's their Medicare ID. You're going to go ahead and enter that in. You're going to enter in their last name, their date of birth. All of this information is a combination of their driver's license and their red, white, and blue card, okay? Now, you want to go ahead and put in their date of birth, the date that Part A became effective, and notice that on the card, it'll probably say October 1st, 2017. You only have to enter the month and the year. And I want you to just see how fast this verifies. Now, you're going to go ahead, put that information in. You're going to click continue. And as soon as your computer stops thinking, it's going to tell you exactly what they have. But first, you want to enter their county. It will verify their county. But notice as soon as you get in, you don't have to know where to go. You don't have to click on anything fancy. It's right here. This particular client has an HMO. But the whole purpose and why I'm showing you this is I wanted you to see it literally takes seconds for you to check. So it's not adding much to what you're currently doing. It's going to save the company money. It's going to save on resources, so we're not swabbing somebody that doesn't qualify. And it shows you that this patient has an Advantage plan. It's an HMO. It's something that we don't take. So now you go ahead and collect this person's information. You keep their SOA. You keep right on the back of the SOA if you want to, like their phone number, their information and a note that said, went through the process, verified to Medicare.gov, has HMO. December of every year. For Medicare, it's like October to December of every year. Your clients have the opportunity to choose a new plan. So one of two things can happen. If they don't use this plan, if they presented you their red, white, and blue card and said they had no idea about this plan, they could probably save themselves some money, and you could just tell them, if you want to disenroll from it, you can do that. You could reapply in 10 days. Otherwise, keep this as a follow-up. Follow up with them mid-December, beginning of December, and say, listen, I know that you have a new plan taking effect January 1st. If you'd like for us to see if a PPO plan that you choose may qualify you to have this test run again, then we'd be glad to schedule a new appointment with you. So at least the work doesn't go in vain. You're doing work for the future with this patient because they want the test. It's just a matter of the insurance qualifying. But this particular patient had no idea that they had an HMO plan. They were insistent that they only have their red, white, and blue card, but clearly here we see that that's not the case. So you definitely want to maintain control of that conversation and always do your due diligence checking. And again, it takes 10 seconds to check it, so it's not adding to what you're currently doing, really. Now, I hope that cleared up some of the questions that you guys have on Medicare, Advantage, and supplement programs. I went ahead and put up on the screen for you the 2 different sites that you can utilize to bookmark. You're welcome to use either one. I simply made the bit.ly link just to make it a little shorter for those of you who maybe happen to be out in the field and using a different computer or a different tablet or what have you, and you don't have that link bookmarked and saved. So either one is fine. They both take you to the exact same place. And I hope this was much help to your frequently asked questions for your Medicare patients. If you have further questions, please reach out to myself, Jennifer Cuartas, or any of the other managers on the team, and we will all be super glad to help you out. Thank you once again for being part of AHS, and we look forward to seeing you on the other side of success. Make it a great day.